Earlier this week, we reported the Posey County Health Officer has announced he has COVID-19. He said he felt he needed to be upfront with this diagnosis, and he had another important message to share. So joining me now is Dr. Kyle Rapp, the Posey County Health Officer. Dr. Rapp, thank you so much for joining us. First off, how are you feeling? Are you doing okay?
Yes, I am. I'm not back to 100%. Still have a few lingering symptoms, but overall feeling much better compared to over the weekend.
We're really glad to hear that. What symptoms alerted you to get tested?
Late in the evening, Thursday night, actually I was going to bed, had developed a cough, and I'd kind of felt tired in the evening a little earlier than usual. Didn't think much of it at that time. Then overnight, I had some body aches. And then in the early morning, Friday morning, I woke up with headache, and I had some bowel issues as well. So with the cough, headache, body aches, and the bowel issues, I decided that it'd be best to get myself checked. So I had canceled office, and then had my testing done at one of the Deaconess drive-through testings early Friday morning. And then and then on Sunday, results came back confirming positive.
Okay. Now you also mentioned in your announcement that you feel like that there are many patients and staff don't really need to be concerned about getting tested. Why is that?
Well, based on the CDC guidelines, those who test positive with symptoms, those prior to 48 hours of symptom onsets could be considered close contacts. Thursday, actually, I was only in the office a half day. That's my half day, and I only had 3 or 4 on the schedule that day that I saw in the office. And then the other day was Wednesday in the office. And I've been conscious this whole time with patients, trying to minimize risk as much as possible, keeping appointment time less than 15 minutes. So rarely do I ever have appointments that are over that length of time. And it just happened that reviewing my schedule, I felt none of those were nearly to the 15-minute time limit. And even during the interview process, I'm trying to keep my distance over 6 feet from the patients, only being a close contact within that 6 feet range when it's necessary. And obviously using proper techniques, washing hands before and after every visit in to see a patient. And during the visits, not only were patients wearing masks, I was wearing a mask, and I wear an N95 mask during my visits.
Okay.
So keeping it less than 15 minutes and limiting the exposure there doesn't mean there'd be zero risk, but technically they didn't meet the CDC guidelines of a high contact.
Well, and that brings up the question, you took all the precautions, you did everything right, but still you contracted the virus. And you have a message about this. Does this mean that masks just don't work?
No, I would not say that at all. Nobody said masks are 100% preventative. But as opposed to not wearing masks, wearing masks are very much beneficial in my opinion. I am in a position where I have a much higher risk on a daily basis of contracting it. Not only do I work in my family practice office, I do work in the ER up in Princeton at Gibson General, several shifts a month. So that puts me at another higher risk contact even than in my office, such as in an emergency room. Again, I was using the proper, face masks and everything. Right. But even in that setting, it's possible to catch it. And plus, this very well could have been caught outside in the community.
Right.
I go out. I try to wear masks when I'm in and out of places as well, and I do. But when I sit down, I would go to a restaurant, wore a mask. Once I sit down, I would take it off. So, there are risks out there, right. Even doing the proper technique.
Right, but I know your message is definitely to stay vigilant, wear your masks, social distance, and hygiene. Dr. Rapp, we're so glad that you're doing better. We wish you a speedy recovery, and we certainly appreciate this time you've taken to share the message for people to continue doing the things they need to do to keep from getting, or try to keep from getting COVID-19. Good luck with you, with your health there.
Thank you very much.